If you've ever walked out of a doctor's appointment with nothing but you just need to lose weight, this video is for you. I will say that I was talking to two women in my program the other day, and they were talking about all the things that they've heard over the course of their lives about their weight. It's been blamed for everything from autoimmune disease to joint pain to you name it. And it's simply wrong. I will say that both of these women are in my program for reversing prediabetes and insulin resistance, and I purposely do not talk about weight. I want to be honest though, I did not start here because truthfully, the medical system has this bias built in. And I'm going to talk to you about why this is harmful, what the evidence actually shows in most cases, and what I do instead. And I am Dr. Jenn, if you don't know me. I help women and families reverse insulin resistance and metabolic disease using what I like to call joyful medicine. It's evidence-based lifestyle medicine practiced in a way that's joy first, weight inclusive, culturally inclusive, and honors your lived experience in your life. So, weight bias in medicine is not just rude, it really is bad science and bad care. Most of the studies, I was just at a conference last week and I had an amazing time at the conference. There were so many amazing things presented, but I cannot ignore the fact that there's weight bias built into almost everything we do. No matter what the study says, they say, and lose weight and obesity, even if the study didn't show that. It's automatic almost, and it's taught from the beginning. I'll give you an example. So one of the discussions we were having the other night with the ladies in the program was about joint pain. And one of the women was saying, I know that, movement is bad for my knees. My body is not meant to carry this weight, and it's going to cause a problem for my knees. So I need to find other ways to move that's not going to strain my knees. And I was thinking, your body compensates for what it needs. There's nowhere that it says. It's kind of like the same uh, things that doctors used to say, oh, don't run, it's bad for your knees. That's false too. But the weight bias is really harmful. When you look at the studies, because I was doing a little research about this because I didn't really believe it, and just looking at the evidence there, if you look at the knee arthritis studies, they didn't ask, does moving in a larger body ruin your joints? They ask, among people that we label by BMI, who ends up with a diagnosis of osteoarthritis? And when you look at it that way, you are automatically selecting for those people. Because the thing is, you have to come for diagnosis, right? You have to present with pain. Maybe the people that are moving more, that are stronger, that are more active, that have a lifestyle that supports movement, don't present with osteoarthritis because they're not symptomatic. But they don't ask that question. So to have an objective study, you would need to ask that question. When you do look at people that are in larger bodies that move, they do not have, they are stronger. But there's not been a study that looks at this whole picture. So again, the bias is baked in, and this is throughout medicine. If you look at the studies, often it's lifestyle that's the factor. It's not the size of the body. Bodies come in all shapes and sizes. A body size is not pathologic. Visceral fat is a problem. Visceral fat is inflammatory, but visceral fat is in thin people and it's in fat people. It's visceral fat. So this is a problem. It interferes with the care that people get. People are dismissed for years. They're misdiagnosed. They are avoid the doctor, and it causes real harm. And so I don't think that this is good. When I talk about weight inclusive care, which I will say that I came to this, I'll tell you how I came to this. I always wondered, I always look at the studies and I wonder, well, what I never see the connection of, obesity as a disease and the actual diseases that we're studying. So I was wondering about that. But truthfully, I was working for a practice, and in this age of GLP-1s, we had women coming in that are obsessed with their body weight. I gained 5 pounds. It's bad. People that are of all sizes, people that are larger sizes that are feeling shame from their doctors that have been trying to lose weight and only measure their worth in their weight. And it started to really turn me off. And I started to investigate more, and I read a couple of books, which I'll share in the comments in the description. But I encourage everybody to just think about where your ideas about weight come from and what are they based on? I think that, if you look at history, right, women's bodies come in all shapes and sizes. Women's weights, we have hormonal changes that happen throughout our lives multiple times over the course of a month, even. So to expect our weight to stay the same is really harmful. And often when we focus on weight loss as a goal, we get there by unhealthy reasons. When we focus on health as a goal, when we focus on a healthy lifestyle, all kinds of wonderful things happen. You get health, you get longevity, you get reduced risk of chronic disease. None of this happens when we just solely focus on a number on a scale. So weight inclusive care means that I treat you as a whole person, not as a BMI number or category. I look at everything. I look at your joint health and your heart and your labs, but we focus on your pain, your function, your habits, your sleep, your stress, your environment. We don't just look at a number or make weight loss the goal or the only goal. If you have a goal of weight loss, I will support you there, but I'm not going to require you to lose weight to treat you. And that's important. So maybe I just want to share a few tips if you're running into this problem with your clinicians, with your providers, with your doctor or whoever your primary care provider is. I'm going to give you a few things to think about or two ways to approach it. So you can you're entitled to be treated as a whole person, not just a number on the scale. If you're going to the doctor and every single symptom is getting blamed on your weight, it's reasonable to say, I'd like us to look for other causes as well. Or you can ask, if my weight were different, what other tests would you do? What other treatments would you offer if I had a different weight? Can we consider these now? If your weight is distressing, if you do not like being weighed, if you don't want to be weighed, you can ask to not be weighed. That's okay. As a pediatrician, we weigh our patients in the first 2 years of life, first every visit. In the beginning, it's important because we need to make sure that babies are growing appropriately. But I would argue that it's probably not necessary to weigh older children that frequently. Our obsession with weight is probably not as appropriate. And especially for adults, there's certain cases, right? If you have kidney disease or heart disease or some other concern, a nutritional concern, then maybe a weight is appropriate. But again, you're perfectly within your right to say, I prefer to skip weight, or do a blind weight instead. If a provider shames you or refuses your care until you lose weight, it is their bias. It is not your worth. And so when you can, it's okay to seek a different clinician or bring an advocate with you. So you deserve care as a whole person, not as a number on the scale. This is what I practice in my practice. I help people address metabolic causes of disease without focusing on weight. We focus on lifestyle. We focus on joy. We focus on nervous system regulation. We focus on flavorful food. We focus on movement, joyful movement, and all of those things, but not weight. So if that's something that you're looking for, feel free to book an appointment. I see patients for medical visits in New York and Vermont. In Vermont, I do a coaching group that happens several times a year for reversing metabolic disease. Both of those will be in the description below. I would love to hear your experience. Thanks for watching.